active correspondents and MBA students.
Hello, can you hear me, Crimilda?
Yes. Yes, sure I can.
Yeah, please project your voice better. We can't hear you quite clearly.
Okay. Please bear with me. This side will have serious problems of network.
Yeah,
I was saying,
sorry about that. Yeah, go ahead.
I'm Crimilda Macuacua Mozambican, social activist, reality TV correspondent, MA student of journalism and media studies at Rhodes University, South Africa, where I am currently, and I'm a fellow Libertarian.
Okay, thank you so much. Next, I'll go to Mugabi. Please tell us about yourself briefly.
Okay, thank you very much, our host Musira Moki. I'm Mugabi John Socrates, first a libertarian, African libertarian activist, and also founder director of Action for Liberty and Economic Development. I'm from Uganda, and our organization Allied operates in Uganda. Thank you very much.
Okay, thank you, Mugambi. It's good to see you, Babu. Karibu sana. Belinda, please tell us about yourself briefly.
My name is Belinda Odek. I'm libertarian. I'm from Kenya, the president of YAFO, the founder of Bridge Africa, and the Africa Regional Coordinator of the Basa Society Program.
Okay, thank you so much. Babu?
Hi guys, how are you doing? Babu, I'm Burugu Babu. I am a libertarian too. First and foremost, it's a pleasure being here, Musila, and the whole Liberty Sparks team for having us to have this discussion today. Well, what do I do? I'm from the African Students for Liberty. I'm the academics programs lead for the Anglophone countries. I'm also the regional coordinator in charge of Kenya and Somalia. I really look forward to the discussion that we're going to have today. Good to see you guys. Hey, Belinda. Hey, Mugabi, Crimilda. How are you guys?
Good to see you. Good to see you.
Good to see you too.
Okay, thank you. Thank you so much, Babu. We still have Solomon from Tanzania. I'm hoping that he's going to be joining us as we go on. So first, I'd like to begin with John Mugambi. Of course, I've been following the work that you've been doing with the LED, and as I began by saying, I understand that most of the work that we libertarians do, or rather the libertarian movement is trying to do and accomplish in Africa, is to spread the ideas of liberty, and most of that has always been involving, hosting, having meetings, conferences, training sessions, and so on and so on. But that has not been possible during because now we've had to work from home and control the spread of COVID-19. So Mugambi, please kindly tell us how has COVID-19 affected your activities in Uganda as a lead, and what have you been doing to try and fill the gap that has been created by the whole requirement of social distancing?
Okay, thank you very much, our host. First of all, I don't know whether you know this, in Uganda, the government took over the responsibility of helping people, of determining the freedom of people, what to do, where to go, and what sometimes you should respond on COVID. So the COVID crisis, as you know very well, it threatened, first of all, the freedom to move, the freedom to interact, freedom to associate, and also the freedom of speech and freedom of expression. Our government on 18th March passed the lockdown policies of curfew, where you don't have to move beyond 7. And that it went on also to declare if you give someone food, whether it's starving or doing one, as attempted murder, the government remained the monopoly of helping or showing love. So anyone who could show love to the needy person, that was attempted murder, and it was against the directive of the president. But also the meeting, as you've said very well, that our think tank engages the society, first of all, in organizing meetings and sharing ideas, sharing experience, and also the advocacy we do sometimes. It's advocacy involving media and other people. But COVID took away or threatened all the possibilities of doing that. But also, as human beings who are spirited to see freedom thriving, we devised means of how, first of all, to help the community as far as freedom is concerned, and also to guard the civil liberties. One of the alternatives or the solution we came up when we realized that the violence of the state was so much. The soldiers could beat people even if they moved before curfew time, if people were trying to save others, giving food. So we managed to get some pro bono services from our friends who are lawyers, and we intervened. We went to the police and to the cells, requesting for justice for those people to be brought to court and even to be released. And fortunately enough, we had some of our friends whom we managed to rescue from the cells, and they were released and they gained their freedom. But it was through even trying to raise our voice, shout out for freedom on different social platforms, on social media, and even making calls, making noise, and also utilizing the village radios. I don't know whether in some of your countries there you have what we call the village radio. It's like a kind of speaker which speaks to the very many people in the village, and each spectrum ends somewhere. So we've been utilizing that. But also we realize, because the libertarians, we are pro-life and pro-choice, we realized that people could not go back to their businesses, and people had become beggars, and the government was continuing to put people into this situation of trying to beg as well as starving. There is a market in the municipality where we are, which was closed because of the negligence of the municipal council, where it could not give strict guidelines for people to distance, for people to use sanitizer. But the municipal or the local government took advantage of that, and it closed the market without even assessing what could be the impact. As our think tank, we realized that many people could survive if they have something they could sell, as well as also considering the guidelines of government. So we gave this picture to the town clerk and the mayor of the city, told him that our city, our municipality is going to have many people starving, many people becoming beggars, not because they want, but because they have goods in their stalls at the market, but they cannot sell it. So we interacted one-on-one with different respective leaders in the community, and they also understood. But we also engaged the media. I remember those who have been following, you could see I addressed that media on that particular market where people could not work. But thank God, they responded, the municipal council responded positively, and it opened up. But also looking at our work, because our work has been interacting, conferences, meetings, and so forth, we are moving towards utilizing the opportunity of the social media, and also the opportunity of using the media, because the media in Uganda is now at the center of getting whatever information and whatever activity goes on about COVID. So we have been engaging some media. We have been writing also some articles, trying to shout, trying to give alternatives and others so that people can see what is really happening. Because according to the experience, the way we can fight, or I will not say fight, but the way we can make the people to see what is being experienced as far as government work and management is concerned is the information. If people have information of what is happening, how is it done, how is their money being used in the name of saving them, but it's only a few people trying to enjoy it, I believe we can make people aware and break the ice which does not see how this big government is trying to make situation worse instead of solving the problem at the stop. I would also lastly, as I conclude, I will talk about, I don't know, Liberty Spark through IGA. We are very, very grateful. IGA Ronald with the Liberty Spark Uganda, he identified a gap where many of the people in the area lives were starving, and he went on with an initiative which I appreciated so much of fundraising over $2,000, and he provided food to these people. And I think it's still ongoing. But also we've got, there's Orache Francis, who is one of our fellow staff, but also former national student for Liberty Coordinator in Uganda. He engaged into some small entrepreneurship where he trained into making soap, which became the sanitizer of his district, because COVID found him in the eastern Uganda, a far district where even there is no network, but people could not even access soap or sanitizer. People do not know how to wash the hands very well. So this Orache, who is a libertarian, we discussed, and I told him that he can be provoked to do something. And he went to use his own money, bought the materials, and started training on how to make liquid soap, and also how to take sanitizer to people who had problems. So the initiative was very good. Also, Gilbert, I hope you know Gilbert. Gilbert was also the founder of Student for Liberty chapter at Nkumba University. He works with Alec also. He went on to to solve the problem of masks, because people were not having masks, and the government was trying to monopolize the making of masks. So what he did, he engaged the private sector, the people at the grassroots, SMEs, most of the women who could be able to make these materials or the mask, and later they made the mask. But also as Ali, we are looking and moving towards the direction of starting to utilize the virtual space. We've been also using our webinars, we've been using webinar, we've been using Zoom. But today we had a meeting, it was an opportunity. I attended the meeting with the business community. We kept.
Okay, thank you so much, Mugambi, for your input. Yeah, so next I'd like to engage Crimilda. I know that a good thing is she's from Mozambique, and at the same time she's studying in South Africa. Crimilda, can you hear me?
Yes, I can hear.
Okay, would you kindly take us through what is happening in South Africa and also back at home? I know you must have an idea of what's going on in Mozambique, and how the government, both governments in back at home and in South Africa have responded to the whole COVID-19 issue. And yeah, I'd like us to use a maximum of 3 minutes, Crimilda. Can you hear me, Crimilda? Okay, I think we.
I think when we Mozambican government did. Excuse me, can you all hear me?
Yes, we can hear you. Go ahead.
I was saying that the first thing that the Mozambican government did in Africa in general. And when we had the first case of COVID-19 by March 22, the government, the president declared the state of emergency from 1st April. So there were closure of schools, suspensions of visa, and discouragement of agglomerations. And this had so many effects to the people in general. You know how it is difficult to implement home office. It's also difficult to implement the remote learning. And we still have this digital divide. Students could not afford to go through virtual education, but we are still managing to cope. And now the numbers of infected are highly increasing each day. We are now around 662 positive cases and 4 deaths, and 175 recovered. And I give my respect to the health workers. Our health system is not that much good, because we all relay to South Africa whenever we have faced extreme problems. But this time that no one should go outside, our health workers in the front line are doing well, are struggling. I cannot say they're doing well, they're struggling, but with the help of non-governmental organizations who are there providing equipment, it's possible to work. And another thing was that I've noticed is that not only the activists who are working, training on matters of hygiene to these people who cannot afford. And the president last week, he has just announced that he will increase the risk subsidies to the health workers who are at the front line of this combat of COVID-19 by 30%. And also we have insurgents in Cabo Delgado, which makes it difficult to fight the COVID-19, because many people, most of the high numbers of COVID-19 that are found in the countries is in Cabo Delgado, Nampula, and Maputo City. Cabo Delgado, because people...
Okay, if you can hear me, Crimilda, thank you for that update. So what I'm gathering from what Crimilda is saying in the case of Mozambique, and what John Mugabi is trying to communicate, is that there has been generally a lockdown of a good number of countries in response to the COVID-19. So I'd like to welcome Zakayo. Thank you for joining us. We are on course with the discussion. And Babu, can you hear me?
Yes, I can hear you, Moki.
Yeah, so what we are picking up is that there has been a lockdown across multiple countries. And of course, now I'd like to, I know what has been happening with in the case of Kenya, it's about movement. We haven't really gotten to that extent of having a total lockdown on the country. Maybe if you can, try to point us to direction of what has been happening in Kenya, and now respond to the whole issue of having a total lockdown in Mozambique and Uganda. So I'd like to get your view to understand what you think about country. Of course, we've heard the whole issue of human rights. Of course, guys have to work, guys have to eat, guys have to pay rent, and so on. And here's a government that decides to fully lock down a country, no movement of people, and so on. So I'd like to get your reactions, your thoughts. Do you think there's a better way that such governments could have responded?
Thank you, Moki. To start with, as you have mentioned, Kenya failed to go the total lockdown way, and the issues that were being brought forward, that were being brought up about just why Kenya could not go the full lockdown way is a majority of the people, especially in urban centers, who work or who get paid on a daily wage. So going on a full lockdown would mean that these people would not be having something to eat. For example, we're having a place like Kibra. In Kibra, there are around 200,000 residents there. So locking down such a place would mean that the government would have to go the way of providing for their food, providing the water, and thinking about the economic burden that would cause. It would really be dire to. And that's just one area of Nairobi. And so essentially what Kenya did was going the partial lockdown way. And this was locking down, or not actually locking down, but seeding movement into and out of the areas that were appearing to be epicenters of the COVID-19 virus. So what this essentially meant is that they contained, or the government managed to contain the virus in just a few areas. And, most of the rural areas have been left out. To date, we have like around 40 out of 47 counties with the virus, but still a majority of these counties, which are mostly rural, don't have a high number of cases, 10, 15 out of the over 4,000 cases. So was there another way of addressing this? In my opinion, government would have been more cautious in the first days when it was known that the virus would be brought in from outside, and closing down airports and closing down entry ports into Kenya would have been the first thing that would have been done by government. Then from there, now government would have instilled strict protocols, but then I'm actually saying this with the benefit of hindsight. At that time, there wasn't much known about what would be the way forward. But again, I feel because there was a time a Chinese plane flew in with 239 passengers, and government actually even went to the extent of saying the person who filmed the plane landing at Jomo Kenyatta International Airport was a terrorist, but which shows the government to some extent was not really serious in containing the virus from coming into the country. So apart from the, now what has been happening, the cessation of movement, having night curfews being brought about, a ban on public and social gatherings, what I would say this has done is it has just slowed down the spread of the virus, but then essentially it hasn't stopped the spread of the virus. I think there's just still much that would need to be done by the government to stop the spread of the virus.
Okay, thank you so much, Babu, and thank you for being finishing on time. So I'd like to move to Belinda. Belinda, if you can hear me, I'd also like to get your reaction on the various ways in which our governments have responded to COVID-19. Of course, we've seen the case of Uganda, what's happening, a total lockdown. And also we have the case of Kenya, Mozambique, where we're having partial, lockdowns and cessation of movements and so on. So I'd like to get your reaction on what you think would have been the best way for governments to respond to COVID-19 outbreak.
So first of all, how the Kenya government has responded to this, my answer is tried. The reason why I say tried is because it would have been crazy, in my view, if Kenya could have gone into a total lockdown, because we don't have the capacity to sustain that. Like, so many people could starve and stuff. And then being that new disease that nobody really can come out and say they know how to go about it, it's just something that we just have to find a way to navigate through it and still continue with our lives. So now what's important and what I've seen is that given that Kenya is a two-tier governance system, where we have the national government and the county government, and since 2014 we had devolution, and health is one of the units that was devolved to the counties, but you still see the executive, the national government rather, trying to control the health sector. So that has been a big problem, because if you remember, like on the 17th of April, when the chair of the Council of Governors came out saying that the 5 billion shillings, Kenya shillings, has been put into an emergency fund to address this issue. In the county, the health workers are crying. They don't have swabs, they don't have gloves, they don't have any PPEs, but we are told there's money. So there's a problem of corruption. Then there's a struggle between the national government and the county government on who controls the healthcare system. So that, I think, has posed a very big problem. And then if you look at the government response in terms of seeding movements in some of these places that was considered high-risk areas, I think that was commendable on the part of the government, because like 2 days ago, we were at 4,044 cases, 1,353 deaths, and recoveries, and 107 deaths. So really, there was no need to lock down the entire country. And then the other thing I want to talk about is everybody has been pushing the government to do mass testing, right? But like I said before, look at the way this disease spreads. What happens if we say, let's test the whole country today? You can, as soon as you finish testing Belinda, I can just go out and I catch the virus, right? So I would think that the best way to do it would be like test people who are showing symptoms. Then you save on resources, and also you manage the timing, and then you also channel resources to other mitigating elements, like buying beds for counties those who don't have, buying PPEs for health workers, like that. Instead of just saying blindly, let us do mass testing. I think it would waste a lot of resources. We should just test based on people that show the symptoms. Yeah, I think that's all I have to say.
Okay, thank you so much. So yeah, welcome Zakayo. You joined just as we had began our discussion. So we've already heard from Mugabi, with the Ugandan government going the total lockdown way. In Kenya and Mozambique, it's been a bit different, not a lot of total lockdown, but again, we've had a lot of cessation of movement. We can say that, well, it has affected people to a great deal. So I'd like to come to you, Zakayo, if you can hear me, on the case of Tanzania. Well, we've heard a lot of stories from Tanzania, of course. we've heard about what Pombe Magufuli, the president, Daktari, is trying to do. Claiming that we don't have essentially not there being clear information on what's going on in terms of the infections, in terms of the spread of COVID-19, in terms of the steps that are being adopted by the government to try and mitigate, or rather slow down the spread of COVID-19. So Solomon, would you try to bring us to speed as to what exactly is happening in Tanzania.
Yeah, thank you very much. Good evening to everybody. Maybe from Malawi, Rwanda, Uganda, and all Africa, because Africa is one now. I'm happy to join you here, and thank you very much, Musika Mwok, for your very nice introduction. Thank you, Belinda, Mugabi, and many other panelists for your very nice presentation. I was very much listening, and I appreciate your content. Unfortunately, or not fortunately, that we are lucky to be led by His Excellency John Pombe Magufuli, the scientist, the mathematician, and the decision maker, a very, very, very stable president. So we are lucky. In response to the meeting today, to the topic today, you know, COVID-19 or novel pandemic, this disease has been defined in very many or several ways. It has been independent, treated, or uniquely treated depending on the nature of a certain country, the capacity of the country itself in terms of medical facilities, financial support, and the political support or policy influence. Or it sometimes depends on who deciding what. So in Tanzania, we had a very different case, and it is unique all over the world. As you can see that we didn't lock down, and we just banned only the massive crowds like universities, schools, and the colleges. But you can see the very, very big markets like Kariakoo that serves the whole East Africa has been on, and all activities were in a process ongoing. So you can see that COVID for us was not that much big issue, but medical guidelines, professional or health guidelines were in a position. Though we affected in terms of business, especially on air, aviation, and the other sector, especially tourism, because Tanzania depends a lot on tourism. So COVID was somehow universal challenges, and it affected the country because all over the world affected. So as you interlink or you connect this concept that you cannot be independent locally, you have to be connected with the rest, also neighbors, because the economy or the concept of free market and free trade is depending on each other. So our case as Tanzania, we reported several numbers of confirmed cases. You are aware that we reached over 500 plus. And from there, we get the challenges on our, the main laboratory, national laboratory, or we can call it the main, or let's call it the main laboratory, national laboratory, where we found a lot of challenges on a confirmed cases, positive or negative. You remember we even tested the oil, the pulpa, and the goat samples or specimen to find what is going on in the laboratories. And then we find the vehicle's oil negative, and the goat species, specimen found positive. You can be shocked. So we find that all these facilities, laboratory equipment and so forth, were even lying because we're just, it's like a project mentioning that we have a lot of cases for the benefit of, I don't know for who was benefiting with that. So as you can see, as Africans, we have to recognize our own technologies, our own solutions, our own measures. As you can see, Madagascar came up with a very nice local, medical, it was a medicine for COVID, but all over the world, especially WHO, were not able to recognize. You can see the trouble up to now for Madagascar. So Tanzania as well, we have our own medical, medicine for corona, for COVID, corona disease, COVID-19 and so forth. So as you have seen this, it has been, let's say, check and balance, has been up and downs, has been standings from maybe political or medical, scientists and so forth. But by letting, businesses or community or clouds not locked down has been helping us, and has been rescuing our economy, because we know many of African countries cannot manage to facilitate all their people when are locked. They cannot service them. So the only way is to allow people go out, trade, do business, so that they can sustain themselves. So we appreciate the courage of President Magufuli taking his own initiative that helped us. We are not locked in the house, in homes or whatever, and quarantine.
So much,
yeah, thank you very much for your time.
Okay, thank you. So I'm looking at the comments that you guys are making, and I can see that Mugambi is saying that Tanzania happens to be really lucky. So why do you think Tanzania is lucky, Mugambi, in 2 short minutes?
Yeah, thank you very much. Yeah, we started when Tanzania we started getting messages and news from Tanzania about how Magufuli is becoming stubborn not to lock down the country. Many people were like, oh, that is one of the stupid ideas, stupid approach, and people appreciated our president for putting stringent rules and even enforcing all the kind of laws to prevent people from interacting, from exchanging and doing businesses. And even everyone expected Tanzania to suffer. By that time, Tanzania had around 232 cases, and Uganda had 1 case. And when Uganda had 1 case, it locked down the whole country because of 1 case. And guess what happened? After 2 weeks, the case reached 100. After another strict laws of locking down, we almost reached 300. And right now, we are almost at the same stage with Tanzania, which never locked down. So we say, when you compare Uganda, which locked down, but we are almost surpassing the cases Tanzania is having, but we have killed the economy. Many businesses may not resurrect again, they have been killed. People have eaten all their saving, they have consumed the saving they had, and people, they don't know where to start from, and over 500,000 people have become beggars. They have to wait for the food at the plate, and the economy, we don't know. And this is another thing which has also happened. We have got loans over almost reaching $700 loans from IMF, from World Bank, from other countries. We are just getting loans to fight COVID, which is almost non-existent because we have not lost anyone. But also Tanzania, I don't know whether Tanzania has got any loan. It never locked the country, but I don't know. Maybe Babu, you will tell us, our colleague from Tanzania, whether Tanzania is accumulating loans like Uganda, and also how many businesses have been suffocated like in Uganda. So that's why I think Tanzania, Magufuli took a right decision on handling this crisis. But I would like to know, because they tell us Magufuli called the doctors, the Center for Disease Control and what we call the Virus Research Center of Tanzania, and gave them 3 samples of blood, the blood of human being, I hear the blood of another animal, and some sap from a certain plant, and they said every sample is positive. Maybe our colleague from Tanzania will tell us whether it's just some words and funny jokes. So that's why I think Tanzania took the right step, the right approach.
Okay, thank you so much, Mugambi. I'll be posing that question to Zakayo as we go on. But now I'd like to turn to Belinda because we have about 18 minutes to 6 p.m., which is when we are supposed to end this session. So Belinda, I know businesses have been affected almost actually in every other country in Africa because of how the economies are interconnected. Now, as we move forward, of course, I know in Kenya we've the beginning of this month we were waiting for the president to end this directives on the cessation of movement, and Kenyans are still hopeful that by the end of the 31 days given that the country again is going to be open. But now going forward with that knowledge, knowing that businesses have been affected and so on, what do you think it's the right way now that every other entity, governments, the banks, guys giving credit, the policy guys, what do you think should be now the right way to prepare to move forward when the country opens and maybe when we are finally done with COVID-19, maybe in a maximum of 2 minutes? Belinda.
I think what should happen is very simple. The government just needs to get out of the way of people trying to do business, or people who are already doing business. That is number one. Number two, countries need to open up now because we have guidelines from WHO on what we're supposed to do, the basics, social distancing, hand washing and sanitizing, all these basics. We just take them in and we practice them, and then we open up our borders and we open up our businesses so that we can take over, start again from where we left. It's just that simple.
Okay, thank you. Let me move next to Babu. Of course, COVID-19 is here, Babu. Of course, at the moment we don't have a vaccine. I don't know how long it's going to take to have one. In the past, we've had diseases like Ebola, HIV, AIDS that we've been dealing with technically. So, do you think that we can learn to live with COVID-19 and be able to open our countries, other countries be able to open the airspaces and so on?
Moki, thanks for that. By all signs, and the direction of all signs is that COVID-19 is here to stay with us. And if you look, for example, at countries that had already declared themselves COVID free, after some time you're having pockets of new infections cropping up. So ideally, what that means is COVID-19 is not coming to stay, and most of these countries are countries that were affected during the first wave. Before even we would talk about infections in Africa. Then also thinking about the search for vaccine and search for a cure for COVID-19. I was sharing with somebody else, and as Kenya or as Africa, we have the tendency of taking a backseat and waiting for America, the West, and even sometimes the East to come up with a solution. Then we can jump onto that solution. I think COVID-19 is here to stay, and we as Kenya or Africa, unfortunately, we are taking a backseat in trying to find a solution out of it all. Most of the measures and management protocols that we are doing are mostly copy and paste. we are talking about for protocols like social distancing. I mean, and when you go to, I had mentioned earlier, to areas where social distancing is, it's impossible, like in informal settlements. We are yet not we are yet to get to a place where we're having protocols that are tailor-made to our own situation. Another thing that I've seen from the rural areas, the market, the rural areas have market days. And if you go to the markets during, you will wonder, why is even the government saying that no social gathering? Why is government limiting people to go to barrios? Why is government limiting people to go to church? Because, markets are full, people are going to markets during market days. So in towns, people are still interacting. So I feel that what is really needful is for the government to take, to come up with protocols that are tailor-made for the situation on the ground, not just copy-pasting, protocols that are being practiced elsewhere. Because in the end, as as COVID-19 has shown, each country is getting to carry its own burden alone. So then, if each country is going to carry its own burden alone, then each country then has to come up with its own protocols, the best way it knows how to manage the situation on the ground. Muki?
Go ahead, I can hear you.
Yeah, I'm done. I think that I've made my point.
Okay, okay. I don't know
Babu,
what
thank
happened.
you.
Yeah, go ahead, Belinda.
I was just saying thank you, Babu, for his wonderful, opinion.
Okay, yeah, I don't know what happened. I think we had some technical issues. So Crimilda, I hope you're still with us because I can't see your video. Yeah.
Yes, I'm still here.
So what you're saying is in Mozambique, what has happened
I'm
is
still here, yes.
Yeah, we haven't had total lockdown in Mozambique. Yeah, you've said it was a level 3 state of emergency. So that means we've had some movement in the country. But given that the numbers of COVID-19 cases are still going, do you think there's a better way that the government could have handled the whole issue of COVID-19?
Yes, I think that the government although the government have declared the state of emergency even before we had only like 8 cases by the time, but there were still gaps that the government couldn't clear them. For example, when I told you about the issue going on in Cabo Delgado, the terrorist attacks, the government couldn't prevent it until we were hit by this COVID-19, and the conflicts are still there, and people are still moving from one place to another. And when South Africa declared the state of emergency, that's where we saw, I think, the worst of us, because many Mozambicans who live here in South Africa, they turned back home, and they were only quarantined for 2 days at the border, Rosan Garcia border. And next, after those 2 days, they were allowed to go home to go to their destinations. And who knows, maybe the measures of quarantine were not well implemented. The reason why we had these local transmissions going up, if we could been able to control this movement of people, it will be better by the time. And the other issues, like, although we were in a state of emergency, the government still allowed flights from Portugal, which was the high-risk country by the time, to come in the country. And I think this also might have contributed to the high level of raising the infections. And I think there are some measures that the government can do in order to prevent this local transmission in Nampula. Maybe to look into those 3 provinces, to implement full lockdown in these 3 provinces that are massively affected: Nampula, Cabo Delgado, and Maputo. I think that can also help. And the other issue which comes along is how to end stigma and disinformation along this pandemic. What can be done to end stigma and disinformation? And now we have high rates of gender-based violence. So it's like mental health is the issue that we have to focus on, since because it's giving a lot of trouble. Each day or each week, people are dying. So we have also, instead of only looking at the health sector, instead of only looking at the patients of COVID-19, it also have to strengthen their measures to help people overcome the mental illness. And COVID-19 brings a lot of challenge to us, but we can also use it as a tool for us to boost our decolonization struggle. Since the Western are only busy trying to stop the pandemic from spreading to their country, so it's like they're all busy with their own survival. We as African, I think we can take this opportunity to really implement all our ideas that we had before about the African Continental Free Trade Area Agreement. I think this is the good time for us to implement, and a lot have been started. We have Rwanda going on inventing the ventilators. So it's like maybe we should look at what Manguful have said. We have to produce to have the food security in our continent, and also boost the local industry to end this dependence from the outside. We have other countries with these lockdowns have been increasing their full dependence, because these loans that are coming to us, we have to pay them. No way out, we have to pay them, and that can cost us. Our economy is already dying. So it's like we'll have to give all our natural resources to them in order to solve this. So I think when we use this COVID-19 to boost our industries, our agriculture, to feed African, yeah, that can be a good way out, I think.
Okay, thank you. Thank you so much, Crimilda. Now I'd like to turn to Zakayo. Crimilda has raised a very key concern in terms of the spread of information, or rather the flow of information that we are having. In Tanzania, of course, I know we've had the whole issues of COVID-19 being disputed as a very, being dismissed as not a very serious threat in terms of the health concerns of the people. But do you think that there has been a good flow of information concerning, how citizens should be responding to the whole issue of COVID-19 in Tanzania? In about 1 minute or so, because we're running out of time.
Thank you very much. If I cut you clearly your question, but the information flows depends on the center of information and who was mandated or authorized to give the information out. The only government, the only special COVID task force was responsible for information. So we were depending much on the daily updating of all these corona cases, confirmed cases, death cases, and the recovery cases. No one else is allowed to say anything. This was controlled to make no one to mislead. So you can find someone, anyone in the media or social media or anywhere misleading the information, and raise a lot of shocks to people. So, you know, what is killing is not COVID, but the tension, fear, you know, something like that. So what I've made in Tanzania is to make sure that they control the source of information. Once they give the information, is national information from national source, and only Prime Minister, Minister of Health, and President, only three. So this made us being very stable, and it draws a lot of attention and the courage for people to go in business without any fear, any excitement, that made this very strong for us to move from this positive. And as we talk, Tanzania is free of corona, and we don't think that it can be now a challenge anyhow, and everything is okay. Our tourism is now resumed. The aviation is now resumed. The schools and the colleges now resumed, and even the primary schools from 29th June is now resumed. So we are free nation. No one will make this colonized to support any economical or political struggle again. So we can also advise all Africans to stay independent as African.
Okay, thank you so much. So Belinda, what I'm getting from Crimilda and Zakayo is that this is a signal for Africa to depend on herself. Do you think that is the right way to go? Unmute.
Oh, I had muted myself. So what I'm saying is that is actually rightfully the right way to go. But I think as young people, we must learn to start really holding our governments to account, because we're talking about making Africa independent, you know, from aid and stuff like that, relying so much on aid and stuff like that. But do we have the capacity? Maybe we do have the capacity, but how am I managing our resources? Since as though you're talking here right now, we're not in charge of any ministry in government. We're not in charge of any dockets. The ones who are in charge are the ones who control the resources, the ones who allocate the monies. So we have to hold them to account. For example, if the Ministry of Health in Kenya has received 20 billion from the World Bank or from IMF or wherever for Corona, then you have to try and follow up to see how the monies are spent. And you don't have to, it's not a lot of work. What you have to do is you have to identify some of the institutions that do the follow-ups and get the information from their websites. Then you can use these ones to write some opinion pieces on how the government is spending money that it is getting in debts and maybe in aid to fight COVID-19. So it is up to us. And yes, we need to start investing more in African innovations so that we can have good health facilities, so that you can also support our innovators. You know, like I saw in some countries in Africa, people are trying to invent their own ventilators and drones for spraying cities and stuff like that. So we need to support these kinds of initiative. But the most important thing is leadership. Because even if you get all the money from the World Bank, from IMF, from who, but monies go into somebody's pockets, it will not really help us. It will not help our people. Leadership is very important.
Okay, thank you so much, Belinda. Let me, as we conclude, I'd like to engage Mugabi. In 2 minutes, of course, Belinda has pointed out that one key thing that affects almost all of us young people in Africa is access to resources. So ideally, there are certain big things that we cannot be able to accomplish implement. But emergencies like COVID-19 are going to be there in the future and so on. So briefly, Mugambi, what do you think young people should be doing, or how should we be responding? What is our position in making sure that we also make a mark when nations and so on, we are trying to deal with emergencies like this one? Of course, employment is still one of the emergencies that we've been dealing with for a long time and so on. Briefly, Mugambi, in maybe 2 minutes at most.
Yeah. Thank you very much, Musila. I would first of all like to echo my response to one statement that Africa, this is an opportunity for Africa to become independent. Our president has been saying the same thing, that COVID has put us into a position of becoming independent. And what he means is protectionism, protecting foreign industries and companies in the name of supporting our own local industry to grow. And that one is very dangerous because it will, first of all, reduce on entrepreneurs who do in and out trade, and it will also cause scarcity, and then it will also break the global chain of trade and so forth. Many of the African leaders are saying it's an opportunity to go independent, but the policies they are looking at to support their statement are very dangerous as far as economic freedom is concerned. So I would also interest my friend to dig more into what they mean by when our leaders say it's time for us to go independent, produce our own, consume our own. It may be something curtailing the kind of protectionism which may be dangerous. But back to your question, as the young generation and the young libertarian, this is an opportunity COVID has brought to understand how the central government failed in most cases. We have been telling people that it is not proper and it cannot work when central government say we are going to distribute wealth and also solve solution. COVID has given us an experience that even if you put a lot of money at the disposal of the central planners, it will do nothing. Even it may end on the planning committee and may not reach a grassroots. But as young people, we should focus more on economic and creating an enterprising opportunity out of the situation. It is better we in the region, for example, it's the right time to start discovering what can we do with our colleagues in Kenya, Tanzania, as far as business is concerned. Besides just speaking about free enterprise and others, let us discover the opportunities and the gaps. Belinda may need maize from Uganda. How am I going to help Belinda to get that maize in the mutual way as well as also gaining? If Tanzania needs something, what can we do as the young libertarian to exploit those opportunities? So I will interest ourselves, including me, to start looking at the gaps in trade and also opportunities we have in the region so that we can sustain, first of all, ourselves, and we can also sustain our movement as well as creating opportunities for others. Second, as young people in our country, we have a gap. Most of the East African countries are going through election. Uganda will be going into election next year, and I know Tanzania and others, they are following. As young people, it is the right time to start interesting people in the economic manifesto. Let us show our people who are going to be voting that what Africa needs is for everyone, even the young people, to be able to create a thriving business through what he or she is having, the different skills, the different talents and abilities. So let us interest this politician. If you cannot become that politician, let us take this opportunity to interest this politician to create I would say a kind of popular manifesto of economic freedom which these people can adapt. And lastly, I conclude this, as the libertarians in the region, I've always been yearning for this, and I'm so happy with the Liberty Sparks that it's bringing us together. We are coming together. Africa, our region, the Great Lakes and the East African region still has some challenges as far as the leadership, the governance is concerned. Poverty is still high, and other challenges also moving here and there. So let us discover how and where we can work to see that our efforts and our impact is realized in the region. Thank you very much. I'm so grateful for this opportunity.
Okay, thank you so much, Mugambi. So yeah, to our attendees, we are going to have a poll on today's meeting popping up on your screen. So as soon as it does, I hope that you are going to click and respond to some of the responses that we are going to be having. Yeah, it should be on your screen now. Yeah, I hope that you can see it, and I hope that you respond to that. So it's past 6. Yeah, we have about in the next 4 minutes we should be ending this session. But before we do that, I'd like to engage Babu. Someone, Crimilda, mentioned that there has been cases, a lot of gender-based violence cases in Mozambique, and I think the last 3 days or so, what we've been treated to in Kenya, it's huge numbers of underage girls who are pregnant also. And I want to believe that there are so many other social issues that are happening, as even as our countries try to come into terms and deal with COVID-19. So Babu, of course you'll begin by trying to paint for us what the whole issue of gender-based violence and the issues with the girls in Kenya, which I want to believe is an issue that it's happening almost across everywhere in Africa and so on. So we try to paint a picture of how the situation is, and try to give us a way forward. Try to give us a solution of how do we balance these things? How do, in as much as the government and the organizations and so on are trying to come into terms with these as individuals, where do we come, and what should we be doing to make sure that we respond to these issues?
All right. Thank you, Musila. So ideally, I have the privilege of having to work within the gender equality circles, and with COVID-19, two distinct situations yet so closely related have cropped up, and as you have mentioned, one of it is still rife within the trending news of Kenya. So the first one had to do with gender-based violence. So, and you'll see a lot of research articles and research from different organizations will tell you that due to some of the measures that were undertaken by government, like telling people to stay home, and people losing their jobs, meant that breadwinners sometimes had to stay at home. And ideally, what that means is, psychologists will tell you a lot of these frustrations, people who are frustrated will try and meet out their frustrations elsewhere. So there has been experienced an increase in the cases of gender-based violence, because you'll find a breadwinner is at home and they beat up their spouses, they beat up their kids, and it has a relation to what to COVID-19. Again, there was the report that yet though having been played down by government and the Ministry of Health in Kenya, that thousands of school-going girls have gotten pregnant within the 3 or so months that we have been on lockdown, or not necessarily lockdown, or when we've been having corona in Kenya. So some doubts are being put to the numbers. For example, the question of one county having 3,000 school-going girls being pregnant in just 3 months. What does that entail? But even without really relying on those numbers, since they have been disputed, there has been what what has been seen is that coronavirus and the pandemic itself has brought about a lot of gender-based issues that needs to be addressed. So what's the way forward on a personal level and as organizations? One thing is there is the need to follow and respect the rule of law. So if we go by the numbers, if there are 3,000 young school-going girls who are pregnant, you know, in the Kenyan law, that's already under the penal code, that's having carnal knowledge of an underage, a person who has not yet reached the age of consent. So even as much as there's much uproar as we talk about these thousands or these numbers of girls who are pregnant, we need to ask ourselves, who are these people who are, or who are these men who are responsible for these pregnancies? And it's pointed to their age mates, their peers, some of them it's their families. Who are these people who have had carnal knowledge of a person who has not yet reached the age of consent? If we are going to follow the rule of law, these are people who are supposed to be, incarcerated and in prison. If we go to gender-based violence, there are, at least in Kenya, I know there are hotlines to report cases of gender-based violence. And again, as individuals, it's upon us to talk and to speak up against gender-based violence. Silence means, if we stay silent, means we are just accomplices in all this. But our voice, if we are able to speak about it, then we can be able to fight against it, or reduce these cases. Because most of the times that this violence occurs, most people are there as bystanders. But if our bystander, if we don't just stay there as bystanders and are able to interrupt this from happening, then I think that's one way, as on an individual basis, on an individual level, we are able to stop this violence from happening. So I think my time is up, Moki, but that's just something I feel that should be noted.
Okay, thank you. I'd like also to get a reaction, since this is a pretty serious issue and that's affecting our social circles. I'd also like to get a reaction from Belinda concerning the same issues, and Crimilda also, because that's I'm assuming that would have been the reaction from Babu's side, as a male. So I'd like to also get a reaction from one of you, Belinda or Crimilda.
So I'd like to speak for Kenya, but I have to point out that I'm not an expert on gender issues. But I think it's just very basic that our government should have incorporated this issue on their response framework for COVID-19. Because, naturally, people are staying at home. Some of them are not, have been laid off from work. So there's a lot of financial constraints. So you met out your frustrations on your partner, definitely, or somebody that is close to you. I think that was expected. And I think when we had our first partial lockdown, the first 2 legs of it, the government should have done something like incorporate this issue in their response, so that to mitigate the problem. Because it's very difficult. It's not easy for everybody to come out and report some of these cases for stigmatization. Some of them also, they fear their partner might hurt them, if they hear that they reported. But people are really suffering during this period, and that is something that seriously should be looked into. Yeah.
Okay, thank you. So Crimilda, would you respond briefly in 1 minute?
What the Mozambican government did was to make us realize that police are the unique people that we can reach to whenever we encounter problems in this situation. But there's the social protection policy also include these issues of gender-based violence. that we are encouraged to report whenever we encounter this. But now it becomes difficult. We are all confined at our homes. There's nowhere we can go because we are trying to avoid conjunction of people in these institutions. So fighting this issue of gender-based violence becomes difficult. Last week, we had someone climbing climbing a tower, electric tower. It was associated with mental illness. So that's how you see that. That's how we get to understand that this issue is very. We should see it as a priority. And the Psychologists Association, Mozambican Psychologists Association, they have also provided their numbers so we can reach to them whenever we encounter situations of mental illness, and they can also help us throughout. Yeah, that's what I can say so far, but I think there is a lot in this.
Okay, thank you so much. Yeah, I hope you can see the polls that
in this issue,
or rather the results to the polls. So what we were basically trying to ask was to get the views from the attendees on how the government has responded to the social and the economic issues due to the pandemic. And yeah, 86% of you, they say that their governments haven't satisfactorily responded to these issues. The second question was, do you think your government has failed? That is where do you think your government has failed? 43% saying it's on, enforcing social distancing. 71 think that more governments have failed in cushioning citizens economically. 71% also say the governments rather have failed in respecting human rights and transparency in terms of information sharing and so on concerning COVID-19. The third question as an individual, do you feel that you have adequately stepped up to help the vulnerable members of the society? And this is what Mugabi was talking about, what we've got to do as a youth, as young libertarians. And yeah, 86% of you say that they feel that they've done, they have adequately stepped up, whereas yeah, just one of you, that's 14%, said that maybe they've done well in handling, in trying to help the vulnerable members of the society. So thank you so much, guys. I know we have almost 20 minutes past time when this session was supposed to end, but it's been quite an informative session in terms of what your experiences have, how the various governments are dealing with the pandemic, and what the responses are, what you believe that could have been the better way to handle this pandemic. And I hope that we are going to keep on sharing and engaging in the conversations and so on, trying to push for the governments to to be able to handle these emergency and maybe others that are going to be there to be there in the future. I also believe that we are going to be doing our part as individuals, in the various libertarian organizations and the societies that we are living in or working in. I hope that we are going to be doing our part in mostly making sure that the right information is flowing mostly to the rural areas, and guys are informed of what's going on, what's supposed to be happening. And of course, there are a lot of issues, the social issues that are happening in terms of the gender violence and so on. We know in several countries, the police are almost killing the same number of individuals as COVID-19 and so on. And these are some of the issues that we have to keep addressing. We have to keep having conversations on. So thank you so much, Mugabi from Uganda, led. Thank you, Zakayo Solomon from Tanzania, Babu Burugu from Kenya, and students for Liberty, Crimilda. Thank you so much for representing South Africa and Mozambique. And thank you, Belinda, for being with us today. I'd also like to thank our attendees. Thank you for being patient with us throughout this session. And I hope that you've been able to pick a lot of information and understand what's happening within your countries and across the region. So yeah, we've been recording this session, so it's going to be available on our website, www.libertysparks.org. And I hope that you will we also share it through our social media platforms. I hope that you can access it, and if there's something that you need to refresh or maybe share with your friends, you can do so later. So thank you so much. Of course, you're going to be having more sessions like this. This is our 5th session actually since June. So yeah, I hope that you're going to be joining us for the subsequent sessions, and we continue engaging with each other. Thank you so much, and I hope that we continue advocating for a freer and a more prosperous society. Thank you.
Thank you, guys. Thank you so much.